Welcome to Wellness on Demand. Our segment today is called Learning to Live with Diabetes. If you have diabetes, you may think you're alone, but look around you. Chances are high that someone around you suffers from or knows someone who suffers from diabetes on a daily basis. In the U.S. alone, 21 million people have diabetes, and only 14 million know they have it. That means 7 million people don't even know they have this life-threatening disease. African American and Latino populations are hit hardest. About 1 out of every 10 people in these communities are dealing with diabetes. If you discover that you have diabetes, it is critical for you to know as much as possible about this debilitating disease. While the support team of your doctor, nurse, diabetes educator, and pharmacist are there to help you control your diabetes, you are your day-to-day primary caregiver. You will be the one monitoring your blood sugar levels. You will be the one giving yourself medication on a daily basis. And you will be the one who determines how good you feel. Attending classes, support groups, along with self-education through videos like these will help you better understand and manage your health. In this segment, you will receive important information about diabetes that will be helpful if you or a loved one has been diagnosed with this disease. By the end of this program, you should know the answers to the following questions. What does insulin help your body do? What are the common symptoms of hyperglycemia? What are the common symptoms of hypoglycemia? How do you treat a low blood sugar reaction? What should your family or caregiver do if you pass out from a low blood sugar reaction? All of these questions and more will be answered in this segment of Learning to Live with Diabetes. Throughout the program, we'll ask you questions about what you've learned. Now, don't worry, we'll give you the answers as we go along. So watch carefully.
Diabetes is a chronic metabolic disease in which a person doesn't either make insulin or can't react normally to the insulin that they do make. We can think about this as we think about a car engine. You put gasoline into the car engine, and that gasoline is burned and turned into an energy source that drives the car, that propels the car. In a similar way, the nutrition that we take in is converted by our bodies into fuels that our cells can use, can burn to make energy. Well, insulin is a hormone that is produced by our pancreases that allows that glucose to get into our cells in order to be burned as energy. If you don't have insulin, now when your body converts that nutrition into sugar and it can't get into the cell to be used as fuel, now it just accumulates in the blood. And that means that you have high blood sugar levels. Yes. The opposite side of this, if you have too much insulin, now the gas gets in and it's too low, so the sugar levels fall too low, and that creates a different kind of problem.
What does insulin help your body do? A. Lower the amount of glucose in the blood. B. Use blood glucose for energy and storage for future use. Or C. Both A and B. If you chose answer C, you are correct. Insulin helps lower the amount of glucose in the blood while helping the body to use blood glucose for energy and store it for future use. Do you think you may have diabetes? There are a number of symptoms connected with the disease. While just one of these alone doesn't necessarily indicate diabetes, several coupled together can be a sure giveaway. Are you always thirsty and hungry? Do you urinate many times a day? Are you losing weight even though you're not trying to? Have you been experiencing blurred vision or not seeing things as clearly as normal? Does it seem like you're always tired? Have you been experiencing tingling, a pins and needles sensation, or numbness in your hands and feet? Do you experience infections that happen again and again? Have you noticed sores on your legs and feet that don't seem to heal? Are you nauseous or vomiting without any other flu-like symptoms? Any of these may be signs of diabetes. If you experience any of these symptoms, especially if you have more than one, please see your healthcare provider right away to have your blood glucose level tested. Your doctor or healthcare provider will do a simple blood test to determine if your glucose or blood sugar levels are high. If the doctor finds that your glucose level is equal to or greater than 126 milligrams per deciliter on 2 occasions, or if a random blood sugar is over 200 milligrams per deciliter, along with other symptoms, you will be diagnosed with diabetes. There are 2 main types of diabetes, type 1 and type 2. Type 1 diabetes usually occurs when the body doesn't produce enough insulin to regulate the sugar levels in the blood. If you have type 1 diabetes, you'll have to take insulin for the rest of your life to provide the extra insulin your body needs. Type 2 diabetes can be treated in a number of ways that may or may not include taking insulin. Being overweight contributes to type 2 diabetes, so your healthcare provider may suggest a plan of diet and exercise to decrease the glucose levels in your blood. It's very important to follow this plan. If the plan doesn't bring your glucose level down, your doctor may need to prescribe pills or insulin shots to help you further control your glucose level.
The first thing that we have to point out is that type 2 diabetes is by far and away the most common type. This is the kind where people most often are obese, inactive, they have a sedentary lifestyle, that is, they're not very active, and most often people get it in their 40s and 50s. It's very common among certain racial or ethnic groups, African Americans, Latinos, American Indians, East Indians. All of these are groups that have a very high risk of developing type 2 diabetes. Type 1 diabetes is very different. In type 1 diabetes, your blood sugar levels go up high because your body simply cannot make any insulin. You have to take insulin for life with type 1 diabetes, or else you will have serious problems. Type 2 diabetes is one of those progressive diseases that goes through different stages. In the early stages of type 2 diabetes, you actually have a situation where your body makes insulin, not necessarily in the right amounts that you might need, but you can make insulin. Your body actually just doesn't react normally to that insulin. You can actually treat those people by increasing their physical activity, giving them more exercise, changing their diet so that the insulin that they do have doesn't have as much work to do. Later, when that insulin production falls, as it always does in people with type 2 diabetes, now you have to find ways of kicking that insulin level up a little bit. So there are certain pills that you can take. In the long run, people with type 2 diabetes will eventually require insulin therapy, just like people with type 1. It's simply a matter of over what time period you get to that point.
Has your healthcare provider diagnosed you with diabetes? The most important part of keeping your diabetes in check is monitoring your blood sugar level. If your blood glucose gets too high or too low, you may feel sick, tired, or run down. Your healthcare provider and diabetes educator will teach you how to monitor your blood sugar levels. Your support team will help you choose a monitor that best fits your needs and is covered by your insurance plan. It is important that you choose a monitor that provides accurate readings and is easy for you to use because you may be using it up to 3 to 4 times a day. If possible, choose a monitor that requires a smaller drop of blood, does not require coding, and has a memory function. The monitor's memory function will help you keep a day-to-day record of your blood glucose levels. Checking your blood glucose level will tell you if you need to increase or decrease oral or injectable medications. Testing requires a small drop of blood, usually from a finger, forearm, or other part of your body. For example, you would prick your finger by using a sharp pin called a lancet. The lancet is spring-loaded and fires the point of the pin into your fingertip, causing very little pain. After you have pricked your finger, you will gently squeeze the fingertip to form a tiny drop of blood. This drop of blood is then applied to the glucose monitor to determine the level of sugar currently in your blood. Using this reading, you will be able to tell if your blood levels are normal or if you may be hyperglycemic or hypoglycemic. Hyperglycemia or high blood glucose means that your blood sugar is higher than normal and isn't coming down as expected. Hypoglycemia, or low blood glucose, means that your blood sugar is lower than normal. If you have trouble remembering the difference between hyperglycemia and hypoglycemia, think of a hyperactive or too full of energy child, just like your blood sugar is hyper or too full of the energy-producing glucose. Both hyperglycemia and hypoglycemia can lead to some very uncomfortable symptoms. Because of the high level of sugar in your bloodstream, hyperglycemia may bring on many of the same symptoms you had when you first discovered your diabetes. These symptoms may include frequent thirst or hunger, being tired or sleepy all of the time, frequent trips to the bathroom to urinate, especially at night, blurry vision, infections that occur over and over again, slow healing cuts or sores, or itchy or dry skin. If you're experiencing hyperglycemia, determine what has raised your blood sugar level. Are you following your meal plan, getting the proper exercise, and taking your medicine correctly? If you can't get your blood sugar under control, call your healthcare provider. It may be time to change your medication, how much you're taking, or how you're taking it, especially if you have type 2 diabetes. Since diabetes is a progressive disease, it has a tendency to get worse over time. That means the doctor may have to change the way they're treating the diabetes by increasing your medication or combining medicines in order to keep those blood sugar levels under control. Maintaining a blood sugar level as close to normal is your path to feeling your best. What is a common symptom of hyperglycemia or high blood sugar? A. Frequent urination. B. Confused or angry feelings. Or C. Passing out. Answer A is the correct answer. Just like when you discovered you have diabetes, frequent urination is a typical symptom of hyperglycemia. Not feeling well doesn't necessarily mean that your blood sugar levels are high. Have you been feeling shaky, sweaty, or hungry no matter how much you eat? Maybe your vision is blurry, or you're experiencing numbness or tingling in your lips. These are all symptoms of hypoglycemia, or low blood sugar level. Additionally, you may experience a headache, tiredness, confused or angry feelings, a faster heartbeat, or at worst, you may pass out. The symptoms of hypoglycemia or low blood sugar can be a result from taking too much diabetic medication, exercising at the wrong times, or not eating right at meal times. If you feel any of these symptoms, do a blood glucose level test immediately to double check if this is the problem. If your monitor isn't handy, don't take any chances. Letting your glucose level dip too low can make you pass out. Grab something that is high in sugar and pop it in your mouth. Even a little food or drink can help bring your levels back up to normal quickly. What could be common symptoms of hypoglycemia or low blood sugar? A. Sweating, a shaky feeling, and tiredness. B. Numbness of the lips, blurred vision, or passing out. Or C. Both A and B. The correct answer is C. All of these are symptoms of hypoglycemia or low blood sugar.
The most important thing that a patient can do to take control of their own diabetes control is to know where they stand. And that's whether they are treating themselves with lifestyle changes, with diet and exercise, or whether they're on medications, whether those are oral medications or on insulin. The goal here is to get your blood sugars to normal or close to normal. How do you know whether what you're doing is working? How do you know what you do in your lifestyle, for example, the things that you eat, the activities that you engage in, whether those things are hurting you or helping you? The only way you know that is by checking your own blood sugar. That's why self-monitoring is critical.
There are several products available through your pharmacy to rapidly raise your blood glucose, or in an emergency, it's best to keep one of the following snacks handy. 1/2 cup of orange juice or apple juice, 1 cup of skim milk, 6 hard candies, now these must have sugar, 1 small box of raisins, or 1/2 cup of regular, not diet soda. You can even eat several sugar cubes or a tablespoon of sugar or honey to bring your levels back up. If you don't feel better in about 15 minutes, eat a little of something more with sugar in it. If this second round doesn't help, get to your healthcare provider or emergency room right away. How do you treat a low blood sugar reaction? A. A cup of apple juice or 1 small box of raisins. B. 6 sugar-free candies. Or C. 1 can of sugar-free soda. If you answered A, you are correct. Should you experience a sudden drop in blood sugar, eat or drink something containing a quick burst of sugar. Sugar-free candies or sugar-free soda won't provide the dose of sugar your blood level requires if you're hypoglycemic. If your blood sugar levels dip too low, you can pass out. If you pass out, make sure that your family, friends, and coworkers know that they must not give you anything by mouth. When you're passed out, you won't be able to swallow properly and could choke on whatever they're trying to give you to help. Instead, it's important for you to keep a prescription of a hormone called glucagon on hand that can be administered by injection in this situation. You won't be able to give yourself a shot if you're passed out, so teach your friends and family how to inject you with glucagon. Tell them, if you're passed out, to give you the shot even if they aren't sure that your blood sugar is low. It could save your life. What should your family or caregiver do if you pass out from low blood sugar? A. Give you a sugar-filled hard candy. B. Administer an injection of a special hormone called glucagon. Or C. Carefully pour skim milk into your mouth. Answer B. A shot of glucagon could save your life if your blood sugar level has dropped dangerously low enough for you to pass out. Giving you food or drink by mouth may cause you to choke.
The first thing I would say is that you need to make sure that you get yourself connected to somebody who's going to help you manage your disease. Become part of a diabetes team, a care team, a physician, a nurse educator, somebody that can help you learn the ropes about taking care of your diabetes. See what it is about your lifestyle that needs to change. Okay? Get some targets. Goals for your weight, goals for your blood pressure, goals for the kinds of things that you know are going to be important. Commit to becoming a lifelong student. Now you only have to become an expert in one case of diabetes. That's your own. And that means you have to make sure you get access to all of the materials that are out there, and there are lots of wonderful materials out there, and you need to do that. And then get your family, your friends, those people who are closest to you engaged so that they understand what you're going to be up against when you start trying to learn the techniques like monitoring your blood glucose and what those numbers mean. And then ultimately I would say one of the most fundamentally important things that you will have to do is begin to know your numbers. Numbers will become very important to you. Don't accept things like it's a little high, it's a little low, it looks good, it's all right. Know what the numbers should be. What should your blood sugar A1C be? What should your fasting be? What should it be after a meal? What should your blood pressure be? What should your fats be? Know those numbers.
With careful monitoring and treatment of your glucose levels, you should be able to keep your blood levels normal, avoiding hyperglycemia and hypoglycemia, and leading a normal, happy life.
Hello again. I hope you've enjoyed the program. Great job on those questions. If you'd like more information on diabetes, please watch our other segments on diabetes. You can also visit our website at healingourvillage.com, where you can purchase a copy of our self-care guide to diabetes control. You can also purchase videos that you can share with your friends and family. Thank you for joining us today on Wellness on Demand.
Can you recognize the faces of diabetes? 21 million Americans suffer from this chronic disease that, when unchecked, can cause blindness, heart attacks, and kidney failure. I'm very proud to announce that the second edition of Healing Our Village, a self-care guide to diabetes control, is now available. You can get this guide by visiting www.healingourvillage.com. Get this book and empower yourself to take charge of your diabetes and improve your health today.